It is September. A second wave is what public health officers have been warning us repeatedly is coming. With schools reopening and more people back at work, the risk of COVID-19 spreading goes up. As Eric Sorensen reports, it's unclear, though, what exactly we can expect.
Well, I think it's coming back.
Winter is coming, and Kevin Wallace senses COVID-19 is coming back from its summer lull.
Everybody's going to be stuck inside. It's going to be a lot harder.
Marta Pastor says it's already different.
As long as we have these 40-year-olds and under that don't comply.
Young people are getting COVID-19 at a much higher percentage now than last spring. Luckily, not as many need to be hospitalized. At midweek, hospitalizations in the 4 biggest provinces were rising, but far from overtaxing a healthcare system with thousands of beds. Still, when case numbers rise, worse outcomes often follow.
If numbers do remain going in the wrong direction and people are then point and say, well, the hospitalizations are fine, it's only a matter of time before that indicator catches up.
A resurgence of COVID-19 should not come as a surprise. As early as last April, before the leaves were out, public health models suggested what was ahead. Don't expect that curve to flatten out entirely. What with getting back to somewhat normal life, you can expect to see some waves in the fall and possibly the winter. So fast forward almost 5 months after the mass infections in the spring, after getting back to somewhat normal life over the summer, now we are seeing again a rise in cases, up 58% over a 14-day period in September.
But a second surge will not be a repeat of the spring. Many things have changed, some for the better. Hospitals have improved care and better drug treatment. Long-term care facilities have reorganized staffing and access. There is more testing, and more people wear masks now.
We're definitely more prepared now than we were back in the spring. Not only do organizations know what they have to do, public health organizations, healthcare organizations, the government is more familiar with it. We have a lot more experience with this, and people are more understanding of what they need to do.
But some risks are increasing too. We're socializing more now, not less. We're sending children to school instead of sending them home. And contact tracing is still lagging behind. And we're all kind of fed up with the whole routine.
We're acting like caged tigers. There's a lot more at stake than just people being, tired of being at home.
A new surge of COVID-19 seems inevitable, but what remains unknown is how bad it will get, who will get it, and what the next curve will actually look like. Eric Sorensen, Global News, Toronto.